Hi, this is Jonathan Marks, and we're here with another learning session from Eat to Be Nice and New Brain Nutrition. I'm here today with Nanda Rommelse, PhD. She's Associate Professor in the Department of Psychiatry at Radboud Medical Center in Nijmegen, the Netherlands. She's a clinical neuropsychologist, and she's working on the Karakter Child and Adolescent Psychiatry Project for New Brain Nutrition. We're doing 4 different clinical trials, and Nanda is going to be talking about one of them. In particular, we're talking today about food and ADHD on restriction diets and supplements and probiotics. And here you can see us on screen live, and here we are on your screen. My name is Jonathan Marks. Again, I'm the Dissemination Director for New Brain Nutrition, which is our dissemination project for the Eat to Be Nice project, which is funded by the European Union. So Nanda, with that, we'll turn off our cameras so everybody can see the slides full screen.
Thank you, Jonathan, for this nice introduction. Together with Alex, I'm coordinating work package 2 within Eat to Be Nice. And this is all about nutritional interventions. So all the effects food can have on our behavior. This is really a promising field of research, and in this work package we are coordinating 4 clinical trials that examine the effects of nutritional interventions on impulsive, compulsive, and aggressive behavior. And today I would like to share with you some data on various nutritional interventions that may be fruitful in the future to implement in clinical practice. So first of all, it's important to discuss the reason why we need to develop new innovative treatments. And that is because most treatments have a short-term efficacy. So this efficacy on the short term is really well established. But for instance, for pharmacological interventions, it's known that you need to be treated with these medications, sometimes lifelong, to profit from the effects. And we also know that this comes with side effects as well. Importantly, for instance, for ADHD, there has been no established long-term efficacy of pharmacological interventions. So we really can't say to parents, well, if your child takes this medication now, it will really do better in the future. It will really have a higher level of functioning in the future. We really don't have this data yet. It's no convincing data. And we also see that demands on effective treatments are increasing. So parents, but also clinicians, they ask that not only the core symptoms need to be reduced, but they also ask that behavior is normalized, that there is an increased quality of life, an improvement of quality of life and functioning, that there's also improvement of associated problems like cognitive problems, that there is an established reduced risk for substance abuse disorders, for instance, that we know many children and adolescents and adults with ADHD have an increased risk of developing substance use disorders. And as said, there is a growing societal concern about safety of available medications.
And there's kind of an excitement as well about the possibility that the food we eat could actually have a positive effect.
Exactly. With less side effects. So there's increasing knowledge, increasing beautiful studies showing that food can substantially affect our mental well-being. So not only our physical well-being, but also our mental health well-being. So what we also know that many children that receive medication for ADHD eventually discontinue their medication within 1 to 2 years, often because of these side effects. And there is increasing societal interest in, issues like training or practicing your brain, as well as interventions that are less invasive and more natural. And there's increasing interest in more individualized treatments, so tailor-made instead of the one-size-fits-all approach. So criteria for new treatments are that we establish efficacy, but also safety and effectiveness, cost effectiveness, which is of course important if our health insurance want to pay for these types of treatments. acceptability, accessibility, and affordability, which are all crucial points if treatments are really implemented in clinical care. Treatment can be really effective, but if it's, for instance, too difficult for patients to adhere to the treatment, then it's really no effective treatment at all. So I want to show you the latest results from scientific research on various topics, nutritional topics in relation to ADHD, which contain both artificial food colors and preservatives, sucrose, supplementation of omega-3 fatty acids, supplementation with micronutrients, what we know about diets, and specifically the elimination diet, and what we know about the possibility to treat ADHD symptoms with probiotics. So there is a lot of concern about the safety of artificial food colorings and preservatives. It's almost impossible nowadays to eat food that does not contain food colorings or preservatives. Many foods that are available in the supermarket contain these substances. And even though there are regulations regarding the quantity of these compounds that are allowed in our foods, these regulations vary substantially between nations. And that alone is already surprising. If we think that these regulations are really based on scientific research, there should be much more consistency and regarding these regulations across countries, but there's huge differences. So the link between artificial food colorings and preservatives on the one hand and increased risk for developing ADHD on the other hand is already long recognized, already in the 1980s by Feingold. His hypothesis was that there may be children with an allergy to these food colorings and preservatives that may develop ADHD symptoms in response to that allergy and in response to eating these compounds. An elimination diet was developed that would remove all these kinds of additives with the hypothesis that if children with a high level of ADHD symptoms would follow this diet, that their ADHD symptoms would diminish.
So Nanda, just to make a point clear, you're saying that what Feingold showed was that the additives and the flavors and the preservatives increased the symptoms. They didn't cause the symptoms themselves, correct? I mean, these children have ADHD and it was just that their symptoms were made worse? Or are you saying that they actually caused ADHD?
Yeah, so it's a really good question. A couple of studies, several studies have been performed in this area of research. And what they did, they included children with already manifested ADHD symptoms. And of course, we don't know if the colorings and preservatives elicited or really caused these ADHD symptoms, or that they were one of the several factors that created or really caused these ADHD symptoms. But what he attempted was showing that when you exclude these colorings and preservatives from the food, you would expect to see a drop in ADHD symptoms that would pretty much be close to a causal relationship. If you really expect that certain compounds are really triggering these symptoms, if you would exclude compounds from your food and you see a drop in ADHD symptoms, that's pretty strong evidence that there may be a causal relationship. Of course, only when it's done within a randomized controlled trial with a good placebo. Because you know that if parents and teachers are expecting to see changes in the child, they will see it, even if you give placebo.
Right.
So good clinical trials are really needed. And I will show you in a couple of minutes how far the research in human subjects is on this area. There is actually much more known about the effects of food colorings and preservatives in animals. A really high quality study that was relatively recently published it showed that in Drosophila, so those are flies, which can display ADHD behavior. That's really interesting, of course, in a fly. I'm not an expert on that, but apparently you can measure it quite reliably. But what they did was at various levels of these colorings and preservatives to the food of these larvae. And what they saw was that the higher the dosage of these compounds, the lower the survival rate of these larvae. So they really showed a dose-response relationship in the sense that the higher the dose, the more toxic it was on these vulnerable larvae. Mm-hmm. And they also showed, so the upper line are really larvae exposed to nothing, so the control condition. So you can see the survival rate is almost 100%, which with increasing age, that's on the bottom line, well, their survival rate drops, of course, because they don't live very long. So after a month or so, you see the first larvae die. But the larvae that did survive initially, that are living at day one, you can clearly see that also their life expectancy is reduced. So not only the survival rate is much lower if you expose these larvae to dosages of these colorings and preservatives, but also if they survive the early days, the life expectancy is also reduced.
Interesting.
And
I think the benefit of using animals, and I know you're going to talk about rats here, but the life cycle is much quicker, right? So you can get results much more quickly.
Yeah.
So this can help us do more further research. You wouldn't want to do this research exactly the same with humans. You can't. It's not legal, but the animal research certainly helps us as we move along the history of doing research on this topic.
Absolutely. Yes. Of course, we always need to be very careful about quality of life in animal research. And I know there are very strict regulations about animal research. The tests that are being done, they need to be really useful. And you can only expose, a fixed number of animals to your treatments or the conditions you want to expose them to in order to make sure that you use as few animals as possible. I'm, by the way, not an animal researcher myself, but there are high quality studies from animal research that are really beneficial for human research as well. So this study clearly shows that, at least in the larvae of the Drosophila, the exposure in early life to these food colors and preservatives is really adverse, really negative effect on life expectancy, with particularly carmine being toxic. Mm-hmm. And when looking at rat offspring, what they did was another really good study showing that if rat offspring are prenatally exposed to, what is called no observable adverse effect levels of a commonly used mixture of artificial food colorings and additives. So these are dosages that are also in our food, that the offspring of these female rats, they show some behavior that resembles behavior seen in children with ADHD, namely an increase of movement and a decrease of motivation. So again, this is not evidence that food colorings and preservatives are causally related to ADHD, but these findings do show that we need to take the effects very seriously and to do more research in this area.
Great. And that's what we're doing in the Eat to Be Nice project, is we're doing research precisely on these kinds of effects.
Exactly. So what we do, for instance, in one of the clinical trials, we exclude these food colorings and preservatives, and that's within the Elimination Diet, and to see if we add that, if that really triggers again the symptoms. Mm-hmm. There has been a really good meta-analysis published on this by John Nick and his colleagues. It included over 700 participants with ADHD. And what they did was examine if excluding or including these compounds in the food really made a difference in the level of ADHD behavior that was observed. And the effect sizes were actually quite small. So when parents were asked about their children's behavior, there seemed to be a small relationship between food colorings and preservatives and ADHD symptoms. When the teachers were asked, there was actually no robust relationship. So even though animal research does indicate that we need to take this really seriously, studies in humans are not really convincingly showing that this is really a key factor influencing ADHD in many children. It was estimated in this article that given the effect sizes, approximately 8% of children with ADHD may have symptoms related to these food colorings.
So again, what Joel Nigg has done is what's called a meta-analysis, which is really looking at a lot of different studies, which is what you see listed here. And as Nanda is saying here, there was not a lot of effects seen from these previous studies.
Yes, so combining all these studies, as you can see, these horizontal lines, they pretty much indicate the confidence intervals, that an effect size is there. And the more the horizontal lines are shifted to the right, the higher the effect size was between, on the one hand, artificial food colorings and preservatives, and on the other hand, ADHD symptoms. So some studies clearly show really large effect sizes, others show small effect sizes or no effect sizes at all. And when you pool these studies together, then a small effect size is there. So this comes down to approximately 8% of children with ADHD that may have ADHD symptoms that may be related to consumption of these food colorings. So if we would translate this to clinical considerations, I think it's important that even though there's a small effect size, so it probably doesn't qualify as a standalone treatment, it may be useful as an add-on treatment for some cases. And I think what is really important is that we adhere to the precautionary principle that is given that there is an adverse effect on a few, combined with the total absence of benefit in all of us, that such ingredients should be minimized in the food supply until proven to be universally safe. And I think a lot needs to be done there.
Yes.
In regulations and doing better research in really getting into depth in this matter, because even though it was a meta-analysis, it still contained relatively few individuals on which this meta-analysis was based. So I think the last word regarding this topic hasn't been said yet. I think we really need more research into this, and in Eat to Be Nice, this is one of the components we are addressing.
It will be exciting to see the results when they come out.
I think, I'm very, very curious about the results as well. I think many parents as well, many parents that already have participated with their child, they are already asking if we can say anything about results yet. But unfortunately, in clinical trials, we are not allowed to do analysis until the last patient has participated. So we need to be patient a little bit more. Okay, so the relationship between ADHD and sugar intake, I think if you would Google this, you would find 1 million hits or something, because it's one of the topics that parents ask the most questions about. Is there really a relationship between sugar intake and ADHD? Many parents are convinced there is a relationship. They see a clear, immediate effect when their child consumes sugar, that in 20 minutes or so, their child is more active. So what is the rationale that there may be an effect between sugar intake on the one hand and ADHD? The hypothesized mechanism is that intake of sugar really creates a release of extracellular dopamine in the striatum. And we are all experiencing this effect that really creates some sort of addiction to sugar. So consuming sugar can really relieve your stress in the short term because it really stimulates the release of dopamine, which really diminishes your stress. So that's why people tend to eat food that is high in sugar when they are stressed. But we also know most children are really, really fond of sugar. And if you allow them to eat, well, as many sweets as they want, many children overeat themselves. Mm-hmm. So sugar has some addictive components. What is hypothesized is that on the long term, if you continue to consume a high amount of sugar daily, that in the end your dopaminergic receptors are being desensitized. And that's often the case if you consume, for instance, nicotine or alcohol. You need increasing amounts to have the same effect. And that is because of this desensitization of your receptors.
Interesting. What is the striatum, just for those people who don't know?
Yeah, if you say it in a few words, it's really the reward center in our brain. It really,
I see.
If it's active, you're really feeling pleasant.
I see. Got it.
Yeah. So in the long term, when you really desensitize your dopaminergic receptors through your high sugar consumption, this may hypothetically lead to a decrease in control mechanisms in your frontal cortex. And we know the frontal cortex is really, really important in understanding underlying mechanisms in ADHD. We know that on average, people with ADHD tend to have lower activity in their prefrontal cortex. The prefrontal cortex is really important in controlling your behavior. So you can imagine that if your frontal cortex becomes less active, then you have less self-control, and that may in turn increase your sugar intake, which again, then you're in a vicious cycle.
Right.
Yeah, so this is really the hypothesized mechanism underlying this. So studies examining the relationship between sugar intake and ADHD, they tested whether placebo-controlled sugar intake really induces hyperactive and impulsive behavior and inattentive behavior. And they did so by, on the one hand, comparing sugar, and on the other hand, artificial sweetener. So not the sugar compound, but really that only tastes as sugar, but really is not sugar. Mm-hmm. So it may be that I didn't search the literature well, but if I'm not mistaken, the latest meta-analysis on this was really published long time ago, in 1995. And since then, our sugar intake has really increased enormously. So this alone indicates that we need to do more studies in this area. And that's also what we're doing within Eat to Be Nice. We're really examining both in clinical trials, but also in work package 1, for instance, where we examine the relationship between sugar intake and mental health in really large samples. This meta-analysis showed that even those, several studies showed effect. When we look at several measures, all effect sizes include 0 in the confidence interval, which indicates that reliably there doesn't seem to be indeed an effect between higher sugar intake and ADHD. But again, the last word about this hasn't been said yet, because this is clearly outdated research. And perhaps and hopefully more recent studies regarding this topic will be emerging.
So Nanda, on the previous slide, you really emphasized the word hypothesis about how all this is working.
Yeah.
And then this second slide is, as you mentioned, a meta-analysis of studies that have been done, but again, it's not showing a big effect size, but more research needs to be done, is what you're saying.
Exactly. Yeah. So
got it.
Even though many parents see effects regarding the sugar intake and hyperactive impulsive behavior, There is a good biological hypothesis how this can be explained, but the studies thus far doesn't show convincingly that there is a relationship.
Interesting.
But luckily, new studies are emerging, and we are actively working on that as well within Eat to Be Nice. But a recent study done in Brazil, what they did was longitudinally assessing sugar intake in children age 6 and follow them up until age 11. So this is not a clinical trial. This is really longitudinally observing relationship between ADHD symptoms and food consumption. And what they saw was that already at age 6, boys with ADHD significantly had a higher sugar intake compared to boys without ADHD. And the same effect was found at age 11, but then less strongly. And it was mainly sweet cookies and sodas and artificially flavored juices that were consumed in much higher quantities in children with ADHD compared to those without. And of course, this doesn't shed light on the causality. It may be that children with ADHD by nature, because of their impulsive behavior, they tend to eat these foods more, or they are more susceptible to these, addictive nature of these foods. But it doesn't necessarily indicate that consuming this food really elicits or aggravates the ADHD symptoms. And that's exactly what they found. So what they did was examining changes in sugar consumption between the ages of 6 and 11 in relation to changes in ADHD behavior over the same period. So what you would expect if sugar intake really causally relates to ADHD, that those children that would increase their sugar consumption between the ages of 6 and 11, that those children would be the ones to, develop ADHD or at least remain impaired if they already had ADHD at age 6. And similarly, children that would decrease their sugar intake would be those children that show a reduction in ADHD symptoms over time. There was no relationship at all between changes in sugar consumption on the one hand and changes in ADHD behavior on the other hand. So what they concluded based on these findings, that higher sugar consumption by children with ADHD may be seen as a consequence rather than a determinant of the disorder, or potentially the damage may already been done prenatally, because we know that higher sugar intake during pregnancy does increase the risk of developing ADHD in the child.
Wow, now I didn't know that. That's a big finding.
Yeah, I didn't know that either when I was pregnant. I would like to know that, but it's too late now. So I think, again, also with translating this to clinical considerations, based on the available studies, it doesn't seem to qualify as a standalone treatment, but it's quite easy to examine the effect of sugar intake in individual cases. So again, in an elimination diet, it's quite easy to temporarily exclude sugar from your diet and examine the effects on your mental and physical well-being. And particularly for children whose parents really feel strongly about the relationship between sugar and the behavior of their child, it's really, really a good opportunity to examine this under supervision of a dietitian. But parents know their child best, and if they regularly see that consuming certain food really aggravates ADHD symptoms, it's really worthwhile examining this relationship. But what we really need are studies examining the long-term effects of high sugar intake. We know that it really has adverse effects on our physical well-being. Those effects are well established. but the effects on our mental well-being, they're really less frequently studied. So that's what we really need to do. And that's also something in Eat to Be Nice what we'll be examining.
Wonderful.
Okay, so another topic that has really creates a lot of interest in the public, and also many parents that are asking us, is this really effective for my child with ADHD, is the supplementation of the diet with omega-3 fatty acids. So omega-3 fatty acids are already, for most of us, in our natural foods. So certain fish contain it, of course, also in certain beans and nuts, and also olive oil. So the rationale that there may be a relationship between ADHD, or in broader sense, mental health, and omega-3 fatty acids is that approximately 25 to 30% of our fatty acids in our brain are rich in polyunsaturated fatty acids. So our brain really needs this to function, to say it simply. And for instance, our serotonin synthesis, release, and functioning in the brain are modulated by these omega-3 fatty acids. And we know that serotonin is vitally important for a variety of brain functions and behaviors. For example, executive functions and also social behavior. Also, a strong relationship with anxiety and depression. And because our body is unable to synthesize it ourselves, these omega-3 fatty acids, we really should consume it through our nutrition. And I'm afraid many of us do not have the recommended daily dose of omega-3 fatty acids in our eating patterns.
Mm-hmm. Now, with the sugar, you were talking more specifically about ADHD, and here with omega-3, you're talking more generally about the healthful aspects of omega-3. And I guess my question is, in these studies that we're doing, I realize that we're really focused on ADHD in many cases and possibly some other disordered behaviors, but is this in general good information for the general public?
Yeah. Yes, it's a really good question. It's for omega-3, but also for sugar and also for supplements in our diets. There are no effects that are only specific to ADHD. So all of the findings that are shown to be relevant in relation to ADHD can be really interpreted as being relevant to our mental health in a broader sense. Children, individuals with ADHD are no different than those without. They are more impulsive, more hyperactive, and have more difficulty in concentrating. But the effects of nutrition on the brain are really there for all of us, and not only for those affected by ADHD.
Got it. Thank you for that clarification. That's good information to have.
A really good meta-analysis showed that when examining blood levels of individuals with ADHD, there was indeed, on average, a reduced level of omega-3 in the blood of individuals with ADHD. So this really supports the idea that, on average, individuals with ADHD may lack these components, relatively lack these components in their nutrition, and it may be fruitful to supplement. And supplementation is actually really easy. Many foods often are enriched in omega-3, for instance, certain types of butter, but there are also capsules available to supplement your diet. And if we look at randomized controlled trials examining the effects of supplementing the food of individuals with ADHD with these omega-3 fatty acids, there's again a reliable effect. It's small in effect size, but it's there. So studying over 1,400 individuals, which is quite a large number of participants, there seems to be a reliable effect there, in the sense that when adding omega-3 to the nutrition may improve ADHD symptoms to a certain extent. And in a recent study, it was examined children with being treated with methylphenidate, one of the most common pharmacological treatments for ADHD, in comparison to children receiving omega-3, or omega-3 insects, by the way, and children receiving the combination of both. So in the solid line are children being treated with methylphenidate, and as you can see, a sharp decrease in ADHD symptoms after starting treatment. In the long term, there was no effect or no difference between children being treated with methylphenidate and children being treated with omega-3 only. So in the long term, after 6 months, there was no difference. Children receiving methylphenidate on the one hand and children receiving omega-3 on the other hand, an equal amount of ADHD symptoms. But omega-3 supplementation took a little bit longer to exert its effects. So where the effects of methylphenidate were visible immediately, the effects of omega-3 supplementation took a little bit longer. And really interestingly was the group receiving both treatments. That's the
bottom line there.
Right? Yeah, indeed. Yeah. Even though it seemed that they were best off in comparison to children receiving only one of both treatments, in the long term, it didn't differ. So in the long term, that's 12 months, there was no difference between the groups. All groups had a reduction of ADHD symptoms. But, and this is really clinically interesting, the group receiving both treatments, they needed a lower dosage of methylphenidate and also experienced fewer side effects of methylphenidate.
Very interesting. Wow.
Yeah, and that's of course for the children and their parents, and also for adults taking methylphenidate, really an important message that it's really. It can be helpful to, in addition to methylphenidate, also supplement your diet with omega-3 in case you really, in your natural eating patterns, have a too low intake of this compounds.
So methylphenidate is it's a long-acting stimulant medication, correct?
Yeah, it's actually by itself, it's short-acting. So you see the effects immediately, so within 30 minutes or so, and usually the effects are visible for approximately 3 hours. But there are all kinds of variants that, because it's been wrapped up differently within the pill itself, it can exert its effect for a long time. So for 12 hours, for instance. But that's not because of the methylphenidate itself, but because of the wrapping in the pill that really slowly releases the methylphenidate in the blood.
Got it.
So again, clinical considerations. On average, individuals with ADHD have lower omega-3 blood levels. And by now there is sufficient evidence to consider omega-3 fatty acids as a supplement to methylphenidate or as a standalone treatment in case parents or adults with ADHD really don't want to take stimulants as treatment or really experience a lot of side effects. But it takes a bit longer to experience the effects. And what we also do not know yet, if it's really needed that we confine this treatment to those having really low blood levels of omega-3. I can imagine that it has more effect on ADHD symptoms if a child or an adult with ADHD really has low blood levels of omega-3 to begin with. And then supplementing seems more logical choice than in those that already eat a lot of fish, for instance, and are a lot of nuts and really have good or optimal blood levels of omega-3.
Now, I think we need to add a little cautionary note here, which is what Nanda is saying is there does seem to be very positive effects on taking omega-3, but you don't want to overdo it, right? I mean, even omega-3, when you take too much, I'm assuming has some kind of toxic effect.
Yeah, that's unfortunately with everything. And there are optimal dosages. So really, indeed, thank you for clarifying this. I may be a bit too enthusiastic.
No.
But indeed, never go beyond the recommended dosage, which is on the package.
Got it.
Okay, so another topic is the supplementation of our diets with micronutrients. Okay, so a lot of us do, a lot of us take micronutrients to supplement our diets. The rationale for this is that there are many metabolic steps in every neurotransmitter pathway that involves the synthesis, the uptake and the breakdown of these substances. And each of those steps require enzymes, and every enzyme is dependent upon multiple coenzymes, cofactors. And those, again, are dependent on adequate quantities of vitamins and minerals that are present. And one possible mechanism underlying ADHD may be inborn metabolic dysfunctions that limits the availability of vitamin and mineral cofactors, thereby resulting in slowed metabolic activity. If that would be true, then it could be correctable through nutrient supplementation. So again, many of us know these packages because we tend to all supplement our diet with micronutrients. And Julia Rookledge, she's an advisor within Eat to Be Nice. She's really on the forefront of this, together with colleagues in the United States and Canada and New Zealand and Australia. And she wrote a really good review on this. And what she concluded together with colleagues is that randomized controlled trials supplementing only a single ingredient provide, well, modest to negligible effects. So really not effective. And she was also advocating to be cautious about this because the administration of only one nutrient may cause an imbalance in other nutrients. And one nutrient is also unlikely to solve all vulnerabilities present in a complex disorder as ADHD. And what she did was examine the effects of trials that really had a multi-ingredient formula, so that really supplemented the whole range of vitamins and minerals that are needed for our neurotransmission. And she showed that in one of the largest placebo-controlled randomized trials, clinical trials, which was in adults with ADHD, there were actually moderate to large effects when supplementing the diet with these broad-spectrum nutrients in a placebo-controlled manner. So what Julia did was repeat the trial in children with ADHD, aged 7 to 12, without medication, and there was a fully blinded a 10-week randomized controlled trial. And blinded means that nor the parents, nor the teacher, nor the researcher or clinician were aware of what the child was receiving, a placebo or the active ingredient. And it was a broad spectrum micronutrients supplementation. And what she found was that those children that received the active ingredients, so the broad spectrum micronutrients, more often, they were much to very much improved in their global functioning, according to the clinician. And she also saw a significant effect on inattentive symptoms. So those children receiving the micronutrients more often had a clinical improvement, so 30% or more improvement in their inattention problems.
Wonderful.
Yeah, indeed. And also those children receiving the active ingredients more often had a reduction in mood problems, so irritability and anger, angry explosions. So that's really, those are really promising results. Of course, they need replication. In Eat to Be Nice, we will be examining the effects of broad-spectrum micronutrients in adolescents and also, adolescents with ADHD. Hopefully, we will replicate this, but it is promising. So again, clinical considerations, the multi-ingredient trials, so really supplementing more vitamins and minerals, they showed promise, but most suffered from methodological limitations. The studies by Julia Rookledge and her group didn't, and really showed promising results, but we really need replication. Importantly, there were no safety concerns in any of the trials, so no side effects. And at least there was evidence suggesting that in the short term, nutrients are not having a negative impact on functioning. What we need to be studying in more detail is the dosage, what is the optimal dosage, and what kind of ingredients are really needed. Do we need to supplement all vitamins and minerals, or only certain vitamins and minerals that are more strongly related to ADHD? But we do not have any data on that yet. We hope to contribute on that in E2B Nice as well. But luckily also other research groups among those of Julia Rutledge are examining this vital issue. And again, also in relation to your former question, be aware that there is an optimal dosage. Too high dosages can really become toxic. And earlier studies have shown that mega dosages can really have adverse effects, so really adhere to the recommendations on the package and do not think, okay, I better swallow 10 pills instead of 2, then I have the super effect. That's really not the case.
So I see here, Nanda, at the top right of your slide, you're going to be doing a double-blind randomized control trial. And as you mentioned, that's where the patient and the researcher and the parents and the teachers don't know which kids are on what, whether they're on the placebo or the nutrients.
Yeah.
And you're going to be doing that trial with 180 adolescents. And when do we think that's going to be done? In what year?
Yeah, that's a good question. That's indeed one of our clinical trials we are running.
Yes.
Oh, that's a difficult question. I don't know the answer by the top of my head.
Okay, that's fine.
Yeah.
So anyway, I think the important thing is we're telling you about these studies, but we're actually going to be doing these studies. And so you'll want to stay tuned to hear the results. And this may take a little while, but we'll keep you informed on our progress.
Yeah, definitely. Okay, so the next topic are elimination diets. Elimination diets are actually already a long time known and used, but mainly for somatic health. So they are used, for instance, to see whether irritable bowel syndrome or diseases like eczema have an origin in food. Mm-hmm. And what it does is in the first several weeks, it reduces your nutritional intake to really a few compounds, or really a few foods that are known to be hypoallergenic, so that they are essentially extremely low risk in evoking any kinds of somatic or somatic symptoms. That most people can eat those foods without experiencing any complaints. Mm-hmm. If you, after these 3 to 5 weeks, see a significant drop in your symptoms, that can be somatic symptoms, but in our case, we measure ADHD symptoms, then it is suggestive that there is a relationship between your nutritional intake and your ADHD symptoms. What then follows is a reintroduction phase in which certain foods or food groups are reintroduced. So you have to eat them in a substantial frequency and quantity to be able to elicit symptoms in case if you're really sensitive to that. If your ADHD symptoms then re-emerge, then it's suggested that you are hyper-allergenic to these foods or specific ingredients in these foods. But if your ADHD symptoms are still relatively low, then these foods likely do not trigger ADHD symptoms in you or your child or the person who undergoes the diet. So this is quite an intensive process for individuals who undergo the diet, who follow the diet, and also those who the partner or parents, because you have to watch your nutritional intake very carefully, and also the reintroduction of food groups and sometimes a re-emerging of symptoms that costs a lot of energy.
Mm-hmm.
But we examine the effects of this diet because there are quite a few studies already showing that there may be a link between nutritional intake and ADHD, and that the elimination diet may be an effective method in examining what kind of nutritional compounds are triggering ADHD symptoms in your child.
So Nanda, you have these 4 phases here on the right. Is the Eat to Be Nice clinical trial going to go through these 4 phases?
Yeah, more or less. It has a similar structure.
Yes.
But the reintroduction of ingredients and certain food groups, they are a bit different than what is shown here.
Yes, got it.
So the rationale behind the elimination diet as potentially effective treatment for ADHD is that adverse physical reactions like eczema, asthma, allergic rhinitis, and so on to foods, they have led to the hypothesis that foods may also have an impact on the brain, for instance, through influencing the microbiome, resulting in adverse behavioral effects. And the microbiome are really the bacteria populations in your gut, and there is a really strong connection to your gut functioning and your brain functioning. And we also know that children with ADHD, as well as adults with ADHD, they have an increased risk of developing these physical reactions. So eczema, asthma, and so on are more prevalent in children with ADHD. And that's why the rationale was formulated that an elimination diet being an effective method and treatment in eczema and asthma may also be effective in children with ADHD. So again, it leads to a temporary total change of diet in which the patient is only allowed to eat a few different hypoallergenic foods, and then a reintroduction phase that can take approximately 12 months.
Wow, that's a long study.
Yes, it is. And a long, quite intensive process for parents and children. Yeah. What we do know that those parents and children that observe really strong improvements in ADHD symptoms, they tend to adhere to the diet. Apparently, the benefits of following the diet are larger than the effort it takes to follow the diet.
Mm-hmm. So
there was a meta-analysis published in 2014 about the effect of elimination diets in ADHD. And overall, there was significant effect. But as you can see, there was a large difference between the studies, with some studies finding no effect at all, several studies finding a really small effect, and several studies finding extremely large effects. And we do not have a clear view what explains these huge differences. Probably has to do with either the content of the diet or the way effects were measured or the expectancy in parents. We don't know yet. What we also do not know yet are long-term effects. So these studies show there is an effect on the short term, but on the long term, so beyond 3 to 4 months, we do not know what the effects are. And that's, of course, critically important if you really want to recommend such type of treatments to parents and children. So within Eat to Be Nice, we try to address these shortcomings by examining the effects of the elimination diet, not only on the short term, but also on the long term, so for a whole year. And importantly, we compare the results of this elimination diet to a healthy, balanced diet. So a healthy, balanced diet is really based on the World Health Organization guidelines about what is a healthy food pattern for children this age range, because it may be the case that it's really not a hypersensitive reaction to food, but that the elimination diet may be restoring healthy food patterns, which is, of course, also feasible with a less intensive, less invasive diet. So we have a randomized controlled trial in which we compare these two diets and see the effects for the short and the long term. And we also compare the effects of the diet to children receiving care as usual, which is often either medication or parent behavioral training or a combination of both. And these results are expected in 2021.
And this is on a group of 5 to 12-year-olds, whereas your previous study, at least with supplementation, was on teenagers. So you're really working with different age groups here.
Yes, yeah. That's indeed the case. And also in other clinical trials, I will show you in a couple of minutes, we are actually addressing adults. So we really try to cover the whole age range.
Great.
So if people want to have a little bit more detailed information on this clinical trial, they can go to our website, which is Project Trace. And people living in the Netherlands, they are still invited to participate if they want to.
Great.
So our last topic is on probiotics. So the most evidence on this topic really stems from research in children with autism. We know children with autism more often have gastrointestinal symptoms like stomach ache and diarrhea, for instance. And we know that probiotics may reduce these symptoms. And it may be the case that there may be a mechanistic link between these gastrointestinal symptoms and autism spectrum disorder, and that probiotics may not only reduce these gastrointestinal symptoms, but also symptoms of autism. There is also evidence showing that there is a relationship between autism and an imbalance in the gut microbiota. So the bacteria population in the gut, and probiotics may restore this balance. Another line of research suggests that there may be an increased intestinal permeability in individuals with autism, which may be ameliorated by probiotics. And a fourth line of research suggests that the regulation of the immune system may be suboptimal in individuals with autism. And we know that probiotics does have an effect on the immune system and may be able to modulate this. So several biological hypotheses how probiotics may, in case of autism spectrum disorder, may improve symptoms. And we know that children with autism spectrum disorder more often show impulsive behavior, compulsive behavior, and also symptoms of aggression. So that's really a relevant population for E to be nice. Again, treatment delivery is not that complicated. You can either consume probiotics through food, but there's also a possibility to, there are certain powders or drinks that you can consume, which increases your probiotic intake. And we actually don't know yet if probiotics may be effective for individuals with ADHD. We think it does because we know that ADHD and autism are really highly comorbid, which means that they often co-occur together within the same individual or within the same family, and they have similar etiological underpinnings. But the probiotic study we are carrying out within E to be nice is the first or one of the first to really thoroughly examine the effects of probiotics on adults with ADHD and also adults without ADHD, so those that do not have ADHD but are highly impulsive, which can, for instance, be the case in individuals with borderline personality disorder. So those are also very welcome to participate. And
again, you're doing this, I see, 18 to 65, so you're really getting into the senior population in this study.
Yes, indeed. Yeah.
And there's more and more research being done now just because this is, what you're really seeing here is the sequence of research that's done over a long period of time. And what's happening now in ADHD is it's really being examined much more closely in older adults to see what the effects of ADHD are and how to differentiate that from other disorders that can happen at that age, such as dementia.
To conclude, so artificial food colorings and preservatives, they are not qualified as standalone treatment, but it should be minimized in the food supply until proven to be universally safe. For sugar intake, again, there's too few evidence to say that it's really qualified as standalone treatment, but it's easy to examine in individual cases, and there's really a strong need for studies examining long-term effects of high sugar intake, and that will be one of the targets within Eat to Be Nice. For supplementation of omega-3 fatty acids, there is sufficient evidence to consider omega-3 fatty acids a supplementary treatment, but it's not yet clear whether such intervention should be confined to children with below normal blood levels. Supplementation of micronutrients, multi-ingredient trials show promise. There haven't been safety concerns yet, luckily, but we need more research, and that will be one of the clinical trials within Eat to Be Nice. For the elimination diet, we see clear benefits in a proportion of children with ADHD, but it is an invasive treatment, and long-term effects are unknown. And we also do not know if it's really needed that children are being put on an elimination diet, or that perhaps a healthy balanced diet is equally effective. So that's again one of the main clinical trials within Eat to Be Nice. And the effects of probiotics on compulsive, impulsive, and aggressive behavior are really unknown. So in Eat to Be Nice, that will be one of the clinical trials that we will be really thoroughly examining the effects of this method.
So we've been talking with Dr. Nanda Rommelse. This has been an absolutely wonderful presentation. It's really been a great overview of all the different kinds of interventions, non-drug interventions that we're studying in Eat to Be Nice. And this is driven a lot by parental and adult desires and problems with, medications and taking medications on a long-term basis. So we're really researching food alternatives, and we're seeing very promising initial results. But what we're doing at Eat to Be Nice is really confirming a lot of the research that's been done previously, and also we're really pioneering new research that we hope will bring benefits to many populations. So Nanda, this has been a great overview. Thanks so much. I know it was a long, a lot of research that you did, and a good long presentation, but really wonderful. Thank you so much.
My pleasure. Thank you.